Interesting day, and we'll get to hear from the Health Cabinet Secretary in just a moment. So, you know, like we said at the start, it was March, it was July, it's March again, and we don't know. So, Sam, take us through sort of the timelines or the schedule that we have been given for this social health insurance fund. We'll talk about all those shifting dates. But what is this we're supposed to have done to get ourselves ready for SHIF, as it were?
SHIF. Or shift.
Shifty. The shift.
Let's not shift the goalpost. Right. So once upon a time, the law was passed. I think it was in the month of October or thereabout. And, or was it September? Well, it was last year, 2023. And after that, on the 22nd of November, the Cabinet Secretary gazetted the coming to force of the Social Health Insurance Act and the various other laws that accompanying that. And then after that, something was supposed to happen. In fact, around that time, there was the appointment of some of the board members to the Social Health Authority, and that is why you have Dr. Timothy Olweny, who is the chair of that board. Then, according to the law, after that, there's supposed to be recruitment of, say, the staff members of the authority. But that is supposed to happen upon the authority sitting down and determining this is the staff establishment that we need, and this is how the recruitment is supposed to happen. Remember that currently the National Health Insurance Fund, that is NHIF, is supposed to be in transition, which must happen by November 2024, which is 1 year since the gazettement. But during that time, there's supposed to be recruitment of the staff of NHIF. At the moment, there's a transitional committee that is in a position that is going ahead in the process of making sure that the transition from NHIF to Social Health Authority is smooth. But so far, there has been nobody recruited for Social Health Authority in terms of staff member, apart from a few who have been seconded from the NHIF, including the Chief Executive Officer of NHIF, who's also the Chief Executive Officer acting for Social Health Authority. But now, why these dates of March? And actually, even before there has been January 1st, the president in November last year said that that law has come into effect, and starting January 1st, there will be deductions to go towards the Social Health Authority. But remember, at that time, there were no regulations. At the time, there was a court case that was yet to be determined. But of course, that is all behind us. At the moment, the Social Health Authority, the Social Health Insurance, and the other regulations that are contained for the 4 laws have been going through public participation. As we speak, the National Assembly Committee on Delegated Legislation just went through the process of having a conversation with the ministry, looking at the regulations themselves, making recommendations of what needs to be changed. And after this, then the ministry is supposed now to go ahead and make those changes, gazette, and then after that, they have to share what has been gazetted with the National Assembly for comments. But now, is it possible to really implement this? Because the conversation, the Cabinet Secretary has been saying, even in January and February when public participation was going on, she had been saying that the public participation would be concluded so that starting March, the deductions happen. Today is 7th day of March 2024. The gazettement of these regulations has not happened. She says that she will be doing that tomorrow, which is a Friday. We don't know whether that will happen. But even if it happens, there's a process that has to be followed, which requires the registration of the members of the authority, members of the contributors to the authority, which has not happened. So as we speak, for the Cabinet Secretary to say that the deductions will commence immediately, we know that last week she actually said they would commence immediately, but then again said they would happen starting July, which is pretty confusing. And this is the reason why many questions are being asked about, so when? Is it this month? Is it July?
That confusion. I remember it was on... okay, if you look, she spoke on 26th of February this year. Mm-hmm. And I think if Robert, you can hear that soundbite. It's soundbite number 3. Let us tell us what she said on 26th of February this year, and then we'll continue.
So our projection is that from this month of March, we need about 3 months to prepare ourselves, because we need a system, a digital system to do registration. We need to test it and then collect resources. But effective the new financial year, which is July, now Kenyans can begin to access services under the Social Health Authority.
This was actually last night when she was speaking during JKL in Kisumu. Right. And just before that, she had told us a week ago about the July 1st date. I think let's listen to bite number 2 about her giving us a reprieve for July.
Our regulations from the Act, this will go on up to June. And thereafter, we intend to begin payments or contributions at the rate of 2.75% with a minimum of 300. And our hope then is that access to these benefits shall begin from the 1st of July.
Okay. So that was about a week ago, telling us now, okay, of course she said that access will start from 1st of July, but she had also said that that's when the contributions will start. But then now she changed last night when we were in Kisumu, speaking and telling us we're going to start deducting the money after starting the end of March. And people had hoped for a reprieve of sorts, because when the July 1st date was announced, people were thinking, oh, phew, thank God we have a bit of time before this money will be deducted. But then this shifting from March, then July, then March again is a bit confusing in terms of how well is the planning for this whole implementation of the Social Health Insurance Fund being done. Because there should have been a list of what we are supposed to do by when. In terms of the law, of course, there's the Act and everything that happened. In fact, in terms of the timelines, this is what we need to do before then, because Gituko mentioned something very important, registration of members. And you're going to talk a bit more about that, Yvonne. Okay, fine. Kesho, they gazette the regulations, if it will happen. But does that give them enough time until 31st of March to get everybody that they need to make the payment? Because the low-hanging fruit in this instance is it's not maybe a good term to use, but the long-hanging fruit are the salaried workers, those who have pay slips, those who you can actually deduct at source before you wafikie. Yeah. But then now we say this thing is supposed to be across board for everybody, even those who are not salaried. Yeah. Of course, we're giving reprieve to the poor in the society, and of course there's means testing, and you're going to tell us about that. But really, what happens to the money that they'll collect end of March, end of April, end of May, end of June, before July 1st when the service starts getting implemented? Where will the money be kept? The systems are not in place. So who will be accountable for that money? As it stands, we don't have a social health an SHA. We don't have it there. We don't have a body in place to manage the funds. Of course, there's NHIF, which is sitting there. We are doing an audit of them. We are doing vetting of them because, of course, part of the reason why we are moving to SHIF from NHIF is mismanagement of funds, mismanagement of the services and all that. So we still don't have anyone in office to be accountable for this money. So where will it be kept? If anything happens to the money, who will we ask questions to? And there have always been issues about money in this country. There's always a suspicion that surrounds pesa. So wanatukata ziende wapi? And it's happened in the past, Yvonne. We have stolen when there have been structures in place. We have stolen when we've had some form of accountability system in place. But now that we don't have anything yet, hizo pesa stand up.
Yeah, that lacuna is important. And I think, like Jamila is talking about, we have seen this before in the country, Linus. Are we too quick to call it, or, is this how other previous ambitious projects have began, but then sort of been mired in some sort of controversy or issue or questions arising?
I think in the plain sense of good communications, the Ministry of Health is not doing well. It's handling this issue in a way that can very easily start breeding mistrust in the public. Because what it reminds me is, if you remember the CBC process, the transition from 844 to CBC. And remember, it started with CS, at the time was Amina. And at some point she had to leave, and another CS was appointed to continue with that process. There is no mystery about a plan that is not clear. And this is starting to show. Terry Rotich, the acting corporation secretary for the Social Health Authority, had indicated that these deductions start in July, the 1st of July. And her line cabinet secretary, Nakhumicha, says, no, it's starting end of March. In fact, we normally know deductions to start at the beginning of the month. This time we are talking of end of March. So there is likely to be confusion among the public on what exactly is going on with this transition. The other thing that perhaps can help this process is clear communication of how exactly it's proceeding. Show the public what is it that you're exactly doing, because you need to build trust. You do not want this process to go the same housing levy route where there are a lot of controversies. You know, this particular one, and I was watching the conversation in Kisumu yesterday when Professor Nyang' Nyong'o was quite receptive of the proposed health insurance, saying that, you know, we wanted to bring it during the National Rainbow Coalition days. Yes, it is a good idea, it is a good dream, but let it not be presented in a way that destroys public trust. And one of the best ways to destroy public trust is to be unclear on what you are doing, have no game plan that is coherent, have the same ministry speaking of different dates, the SHIF acting corporation secretary talking of July 1st, and you as the CS for health talking of a different date. This is not sounding good at all.
Yeah, and that's the issue that we're raising about process and whether that is usually followed. And you know, the question of process in this country, by the way, not just with this administration, has been questioned and challenged legally in courts before. I mean, when a presidential election was nullified, what was at the heart of it? Process. When the BBI process was nullified, what was at the heart of it? Process. When they were talking about, the housing levy, what was at the heart of that? Process. And again here, we're starting to see signs, even at the beginning of this, of are we really clear on what the process is towards getting us from this transitory period, from NHIF into the Social Health Insurance Fund? So what are some of those things? I mean, the basics of planning a project, right? You have project goals and measurable objectives. You have a scope. You build the breakdown structure. You set timelines. So what is your completion date? Are you keeping things on track? What are the duration of the tasks that you have to do? What are the milestones for each of the project phases? So for instance, when she says that, we need to register all Kenyans afresh. So what is the timeline of that? If we keep moving the date from March to July, when are we going to register the people onto the new social health insurance platform that then enables you to know who you are deducting what from? So these are some of the things. Do you determine the plans and the resources? What are the skills that you need? What is the availability of resources? And when it comes to the issue of skills, they talked about re-vetting all of those NHIF workers to see who is fit for purpose and who is not, considering all of the issues we have seen in NHIF. So when is that being done? If we move it from July to March, January, March, back to July, when is all of this happening? You see, things have to follow a sequential order. For you to have a desirable outcome of a process. And when we keep shifting back and forth, it does raise questions about whether we are following a process that then says, okay, we want to revet the workers. We have done that. We're keeping 80% of the workers. We want to register people so we know exactly who we are collecting what amounts from. Like you said, Jamila, there's those who are employed where it's easy. You simply go to the iTax platform. And then there are those who are not yet on that platform. Have you determined things like risks and constraints? Have you planned for quality control and reassurance? And I just want to touch again on, communication, like you mentioned. What is the blueprint for communication on such a huge shift as this? So do we have a plan to say we will give weekly updates, we will give monthly updates, and that those updates are very timely? This is what we said we would do by this time. This is what we have managed to do. The next step we're going to do, and you're telling members of the public and keeping them abreast, which also helps them to do that. But in the absence of timely, effective communication of your plan and where you are, one, creates mistrust, like we've said, but two, then also starts to question the phases of this. And this is very simple. This is the very simple, steps of a project plan. And those are then some of the things that you start to see with court battles. Indeed, this SHIF faced court battles in the beginning, though those were resolved. But that's not the only case. And these are some of the things then that you see will start to happen. Because when the government is not clear in its processes and its steps, and there are some things you cannot skip, then that starts to raise questions around litigation. That's when you see people starting to go to court. You know, is it any wonder that we've seen judiciary either challenges or decisions against government plans and ambitions and projects? And it's, you know, because of issues like this. And this is something that we have had a problem with. I mean, you know, when former President Uhuru Kenyatta tried to do that with the very same housing levy that, you know, is now in place, again, the issue of public participation was the one thing that brought it down during Uhuru Kenyatta's administration. We don't seem to learn. There is a process. There is a way you bake a cake. If you miss a step, it's not a cake. There's a way you cook ugali. If you miss a step, it is not ugali. There's a way we do things.
Now that you introduce food, I like the analogy, because what is happening with SHIF and just like housing levy, we are going for plates first.
Yeah.
And that's a problem. You're going for a bowl. I mean,
there's no food to put in it.
There's no food yet.
Right.
Is the food ready? Is it cooked? Is it what is the arrangement in the kitchen? So I mean, when you tell us to deduct in March, we'll be ready in.
But we receive services
in July.
I don't know about that.
I tell you, I
services
guarantee.
What I know is we start deducting in March.
Yeah.
But we are not ready. We'll be ready in July. So
here's a question, you know, with respect to that. So if we're getting deductions at the end of March, so if a Kenyan falls sick, which health insurance fund are they going to be drawing from?
Like on 1st of April,
yeah, on the 1st of April, if you fall ill, you present your NHIF card or you present what? Like what fund is that you're going to be drawing into? I just want to make one last point, you know, as you come in there. So what we do with this information is up to us. So we'll have deductions in March, April, May, June. June, we have a Eurobond payment due.
Interesting that you say that. And actually, what you're describing is part of the problem, because you charge taxes on a salary, a monthly salary. So it is effective 1st of the month.
Yeah.
You cannot come and charge SHIF from, when is the gazettement happening? It said it will happen on the International Women's Day, which is 8th of March 2024.
There's no need to bring women into that, but it's fine.
It is tomorrow. Happy International Women's Day, by the way.
Thank you, Gitu.
Yeah.
Asante sana.
You cannot effect a deduction starting tomorrow.
Yeah.
Even if you gazette the regulations, and I don't understand why the Cabinet Secretary keeps promising that we're going to gazette. Once you gazette, we shall know. And we will read, we shall report. Kenyans will know. Secondly, so you cannot introduce a levy midway unless it's, I don't know what else. The other thing is, so the SHIF or the health laws are supposed to be promoting universal health coverage. Contributors is every Kenyan, every household. Persons that are unemployed have to pay a minimum of 300 shillings. Those that cannot pay, the government is supposed to allocate resources. So you begin the deductions in March for salaried Kenyans. When is the government making an allocation for people who cannot pay?
Exactly.
But they don't even know
who they are.
People who cannot pay, because they haven't done the registration and determined that.
Exactly.
And done the means testing.
And the other thing is, so you deduct based on a database of contributors. The database that exists today is for the National Health Insurance Fund, whose maximum is 1,700. That is what employers use when they're making the deductions, the calculations, the remittances the following month. So you deduct 2.75% for what database? Because nobody today, including the president, is registered under the Social Health Authority.
Exactly.
Yeah.
So when that happens, and again, the other thing is, so you pay insurance, but the benefit is delayed. It doesn't work like that.
It doesn't, yeah.
You pay insurance so that even if it's a private medical insurance, you cannot be told that start deducting today, but the services will come in future unless you have a pre-existing condition, which is also guided by certain regulations and contracts that you have to sign.
Yeah.
So the fact of the matter is, every Kenyan, including children who are born yesterday or today will be required to be registered within a given period of time. So we're talking about 50 million Kenyans have to be registered so that then they can contribute, and those that cannot afford, payments can be made.
And that takes
Can we
time.
register them? It's what, the 7th of March today? How many days to the end of the month?
24?
Or
Yeah.
Can you register 50 million people in 24 days?
you can't. Even
Yeah.
voter registration takes time.
Takes time. And you know, we have databases, outdated as they may be, because we don't even know how current the NHIF one is, the one that they currently have. But we collect data so much for very many different
And
things,
you
from
cannot use
Huduma
that
number.
because the
from whatever.
regulations
Yeah.
say apply to the authority for registration. Nobody has applied. Have you seen the form for registration?
No. Because we are gazetting regulations tomorrow.
And that's the thing. It's very dangerous to collect money in what seems to be a lacuna of regulations and process. So who would be accountable, like you were saying, for those funds?
Exactly.
Which account are they going to? Because if we decide that NHIF is moribund because the law has been kicked
Yeah.
out and we have a new law, so that money goes to which account?
And who is the person responsible for it?
Custodian
Yeah.
of those things. And then what are employers to do? So they're sitting here hearing all of this. We know how, again, systems and processes work. How do you create a payroll and decide what those deductions are? So there's many questions around this, and this shifting back and forth only helps to raise questions.
Because even as it stands now, if the directive by the minister is to be followed, end of this month, when employers are creating their payroll, they have to implement 2.75% salary reduction from all of their employees in the different pay grades.
And the ones who are not employed?
Watakuja baadaye.
They
So
still cannot do that because you make payments based on NHF number today. There's no,
what number will you
there's no
use?
SHN number for anybody. So it
There
won't
you
happen.
go. So those are questions that continue when it comes to matters of health. But listen, this is, I think, perhaps what we should call the accountability edition, or the edition that questions everything. Because we've got questions with health. Guess what? We've also got questions with what's happening in Haiti. It's been some interesting things that have happened. In fact, we had a visiting president. I'd like us to listen to President